This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Want to know what toxin has killed thieves robbing houses? What pesticide is so poisonous it depletes the ozone layer? Today's episode starts in the emergency department. You walk past room 4 and see a 30-something-year-old man curled up in the fetal position on the stretcher. There's vomit on the front of his gown. His skin has a gray cast. Who is this guy? He doesn't look good, and you haven't heard about him yet. You find the intern and ask her to present the case. She says he's 38 with a chief complaint of nausea and vomiting, onset a few hours prior to arrival. He has abdominal pain, but no focal tenderness on exam to suggest pathology like appendicitis. He's complaining also that his throat is burning, but his tonsils look fine. He's otherwise healthy, and she thinks it's likely food poisoning or gastroenteritis, i.e. a stomach virus. She thinks his throat is burning maybe due to irritation from vomiting and gastric acid. We're talking about the patient in room 4, you ask? An hour of vomiting in a healthy person doesn't match with the patient you saw there. Either does gastroenteritis. Yes, she says. His vitals are temperature of 98.5 Fahrenheit or 36.9 Celsius, heart rate 110, blood pressure is 120/80, respiratory rate of 20, and pulse ox 100% on room air. Let's go see him together, you say. Her presentation and your glance from the doorway just don't match up. The patient is lethargic but wakes up at the sound of your voice. He gives you the same story. He denies significant past medical history, medicines, supplements, and tobacco, alcohol, and drugs. You agree with the intern. His exam is unremarkable. His heart and lungs are normal. There's no abdominal tenderness. He has good muscle strength and sensation is intact. The intern has already ordered IV fluids and on Dancitron or Zofran an antiemetic. Something isn't right here. That said, we don't have much else to go on. You tell the intern to await the lab and urine results and to continue to monitor his symptoms. Maybe he'll improve with IV fluids and antiemetics. It's possible. Or maybe the problem will progress and we'll have a better sense of what additional workup might be useful. An hour later, his basic labs, a complete blood count, and Chem7 come back. There's no sign of infection, anemia, dehydration, or kidney problems. The labs are completely unremarkable. The intern reports the patient doesn't feel any better. You return to the room to reassess him yourself. There's no change in his vitals and no change in his symptoms, just as she said. She's ordered a second bag of IV fluids and another dose of antiemetics. You tell him you'll continue to monitor him. 30 minutes later, the charge nurse calls a code blue. Room 3, you ask, suspecting it's your patient with a heart attack. No, she says 4. Maybe she's mistaken about the room. You rush over to find out. Why would an otherwise healthy 38-year-old with vomiting suddenly have a cardiac arrest? There's been no mistake. The intern in room 4 is standing on a stool doing CPR. The nurse pushes a dose of epinephrine. What happened, you say? The nurse says she was giving a third dose of antiemetics. The patient was awake and talking to her when he suddenly said, "I don't feel good," and passed out. She couldn't find a pulse and called the code. "Time for a pulse check," she says, looking at the clock. The resident stops compressions. You put your fingers on the patient's neck. Nothing. Definitely no pulse. On the monitor, a wavy line crosses the screen like a sine wave. It's a distinctive type of ventricular fibrillation called torsade de pointe. Magnesium, the intern says. You nod in agreement. The nurse pushes 2 grams as the intern restarts compressions. The triage nurse comes into the room and says, "Can I let the police officers back?" "What, you say?" "The police want to come back," she repeats. "For this patient with nausea and vomiting and now a cardiac arrest?" "No," you answer. "Why are they here?" Whatever the reason is, they can wait. 2 police officers walk into the room. Obviously, somebody else let them back. "He gonna make it?" one of them asks. "I don't know," you respond. In-hospital cardiac arrest has a survival rate of about 25%. On the one hand, this patient is healthy. On the other, you have no idea what's causing this cardiac arrest. "He shouldn't have gone inside the tent," the officer says to his partner. "What, you say? Was he camping?" "Even if he was, what does that have to do with this?" "Fumigation," the officer says. "The medics didn't tell you?" "He was laying on the sidewalk across the street from a house covered in a huge fumigation tent." This completely changes the case. Question number 1. It's time to pick your poison. Is this A, carbon monoxide poisoning, B, sulfuryl fluoride, C, chlorine gas? The answer is B, sulfuryl fluoride. Carbon monoxide is a great gas, and you can send a level just in case. But if it was carbon monoxide, the patient should have improved once they were removed from the scene rather than getting progressively worse. Chlorine gas is an irritant causing respiratory failure amongst other things. In addition, it's not used as a pesticide, it's more a weapon of mass destruction. A number of dangerous gases are used as fumigating agents, and we'll come back to some of these, But in the US, only one is legal for use in houses, and that's sulfuryl fluoride. You might know it by its brand name of Vicene. Last week, I promised to tell you about methyl bromide. It's a gas used in the past as a fumigating agent in houses. It doesn't cause bromism, but what it causes are serious neurological problems, specifically generalized weakness, myoclonus or muscle twitches, and altered mental status, ultimately leading to seizure, coma, and death. Currently in the US, it's only used in agricultural settings like greenhouses, warehouses, and ships. Why? Well, it's kind of interesting. Initially, there were some restrictions placed due to very valid concerns about toxicity, especially from an occupational standpoint. In 1992, researchers found methyl bromide causes significant ozone depletion, so that's when its use was really restricted. After methyl bromide exposure, neurological deficits can be reversible, but many patients suffer long-term complications, including persistent deficits. Many can have cognitive impairment, memory deficits, and difficulty with balance. There's evidence even exposed workers without symptoms might have subtle neurocognitive deficits after using it. Phosphine gas is another very dangerous toxin used as a fumigant. Again, it's not allowed for residential use in the US, but it's worth mentioning because it has been used in other countries. And recently, several tourists died in a hotel room in Thailand, and it's believed phosphine gas was responsible. In the US, it is still used to fumigate things like grain silos and rail cars. Tragically, a child died and several men were exposed after riding in a rail car. They either didn't see the signs or couldn't read the signs posted warning of the danger. This hospital and this patient are in the United States, so if it's a house being fumigated, he's been exposed to sulfuryl fluoride. And to clarify, what do I mean by fumigation? If a house becomes infested with pests, often termites, and intensive treatment is required, then the entire house can be covered in a huge tent. They're often brightly colored, exactly like circus tents. The tents are supposed to be airtight, and the pesticide is infused inside the house, left for a certain duration of time, say a few days. Then after the tent is removed, the house is aerated for another few hours or a few days until it's safe for the family to return. Does sulfuryl fluoride make sense here? Was our patient inside the house, or is this a random coincidence? The fumigation tent is there for a reason, not just so the neighbors don't complain about fumes. It's necessary because the exposure is lethal. It can and does cause sudden cardiac arrest. More details in a minute because we need to focus here on treatment first. So what now? To answer this, we need to answer question number 2. What electrolyte disturbance does sulfuryl fluoride cause? I'll give you a hint. It's similar to the electrolyte disturbance caused by hydrofluoric acid. So if you listen to the burn episode, you'll know the answer. And it's the reason both of these exposures are potentially lethal. Is it A, potassium, B, magnesium, C, sodium, or D, calcium? The answer is D, calcium. Regardless of the method of exposure, whether it's hydrofluoric acid or sulfuryl fluoride, which is a gas, in the body, fluoride binds up calcium. You ask the nurse to draw a quick bedside calcium test, and a minute later your suspicions are confirmed. The calcium is extremely low. So the treatment is calcium. Now, if you remember from the burn episode, we have 2 types of calcium, gluconate and chloride. Both can be given IV. Calcium chloride has 3 times the calcium of calcium gluconate, but it carries the risk of cardiac arrest. In stable patients, we would give gluconate. Obviously, our patient is not stable, so I'd move right ahead to calcium chloride. He's already in cardiac arrest. You can't make this any worse. You order several amps of calcium and continue CPR. The heart rhythm alternates between V-fib, V-tach, and torsade. You start a magnesium drip in addition to calcium and try another antidysrhythmic, amiodarone. Was he in the house, you ask the police? Question number 3. Patients have sustained sulfuryl fluoride exposures for which of the following reasons? A, theft, B, suicide, C, occupational exposure, or D, all of the above. The answer is D, all of the above. Fumigated houses have definitely been targeted by thieves. The houses have a huge, brightly colored circus tent advertising no one is home. Clueless thieves, with no idea of the magnitude of the risk, have entered and been poisoned. In one case report, a woman who wanted to commit suicide crawled under a tent. And not surprisingly, there have been mishaps with workers who've been exposed unintentionally. The police say your patient had a pillowcase with an iPad and a computer next to him on the sidewalk. Also in the pillowcase, an N95 mask and safety goggles. In fact, the police were notified by the homeowners after activity on security cameras in the supposedly empty house. The patient still has no pulse. While you continue to resuscitate him, let's talk about what happens after sulfuryl fluoride poisoning. So after you inhale the gas, fluoride ions are released into the body. In reality, we don't have a good understanding of what happens, but we do know that fluoride ions themselves are toxic and likely contribute to the cardiac dysrhythmias. More importantly, probably, fluoride binds calcium and magnesium, causing multisystem organ failure. Calcium is required for muscle contraction, and remember, your heart is a muscle. In addition, hypocalcemia causes QTc prolongation, which we've discussed in the past, is a risk factor for lethal dysrhythmias like ventricular tachycardia and torsade. It can also cause pulmonary edema and respiratory failure. The patient has unfortunately shown no signs of recovery. A repeat blood test shows high calcium and magnesium due to the supplementation and treatment you've been giving him. Sulfur fluoride is reported to affect potassium in some cases, but his is normal. He's still having occasional ventricular tachycardia, but the rhythm has progressed to PEA, or pulseless electrical activity, meaning occasional disorganized contraction of the heart, but it's not consistent with life and not strong enough even to produce a pulse. What else can we do? I always hate to say this, but not much. As usual, we don't have any randomized controlled trials where half the patients are given a lethal poison to test treatment strategies. The dangerous nature of this exposure is a big part of the reason safety precautions are actually mandated by law. One interesting point is that sulfur fluoride is a colorless, odorless gas. It's just like natural gas used for cooking in that regard. Nevertheless, I'm sure everybody at some point has smelled a quote-unquote gas leak from the stove. Why? Because the gas companies add a smelly substance as a safety precaution. That way, if there is a gas leak, hopefully somebody will smell it. It's often methylmercaptan, a substance with a rotten egg smell when it comes to natural gas in your house. Similarly, in fumigation tents, a second agent is added so that the lethal, colorless, odorless sulfur fluoride doesn't go unnoticed. In this case, it's generally chloropyrazine. It's not just smelly, but it's also an irritant, meaning it causes burning, tearing eyes, a sore throat, and can cause vomiting and diarrhea. Its effects are felt immediately. This alerts anyone left inside or entering the tent mistakenly to get out, keeping homeowners as well as workers safe. Our patient had goggles and an N95 mask, according to the police. Why wasn't that enough? Well, goggles might have helped prevent the eye irritation from the chloropyrazine, but a mask is not enough for sulfur fluoride. You need a self-contained breathing apparatus to go in safely, a scuba tank essentially. Even then, there's risk of leaking around the mask, and even a tiny exposure is risky. Cases of exposure are rare, and most reports come from California and Florida. Why? That's question number 4. A, regulatory differences? B, elevated ambient temperatures? Or C, the number of infestations? The answer is actually C. The climate in Florida and California is perfect for termites, and thus house fumigation is not uncommon. I can't tell you enough, really, how dangerous this stuff is. There's a really tragic case of an elderly husband and wife who died within days of each other after their house was fumigated. The couple followed the rules, staying out until the exterminators ventilated the house for 5 hours after removing the tent, including running fans for recirculation. They were given permission to return. The next day, both the husband and wife felt weak with vomiting. 36 hours later, the husband had a cardiac arrest and died. He was elderly, so it didn't really raise any eyebrows. Until 5 days later, when the wife was admitted to the hospital with hypoxia and pulmonary edema, and she died the next day from a cardiac arrest. At this point, suspicion arose. It was too late to test the husband, but in her case, fluoride toxicity was confirmed with an elevated level. What happened? Well, exterminators can actually test the air to check that the sulfur fluoride concentration and make sure it's gone after fumigation. They're supposed to do so before allowing anyone back into the house. Unfortunately, in this case, they didn't test the air, and somehow enough sulfur fluoride remained for days despite otherwise completely airing out the house. It's kind of crazy. We call sulfur fluoride a pesticide, but interestingly, some refer to it as a biocide, meaning it'll kill anything and everything at a high enough dose. One other treatment is a consideration here. It's hemodialysis. Hemodialysis can remove fluoride after hydrofluoric acid exposures. You could consider it, but for acute sulfur fluoride exposure, the patient probably won't be stable enough to get dialysis. Back to our patient. He's been coding now for 50 minutes. You look around the room. The nurses are shaking their heads. You say the traditional last words in a code. Anyone have any other ideas? No one responds. The intern stops CPR and calls the time of death. If we'd gotten the information about exposure earlier, would it have made a difference? If we knew from the beginning and the medics hadn't neglected to tell us, might we have saved him? Almost certainly it wouldn't have changed the outcome. It's a tragic case, but unfortunately sulfur fluoride is an extremely dangerous toxin. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings. Last question and today's pop culture consult. What TV show featured the protagonist using a fumigated house with a tent as a cover for illegal activities? A. The Wire, B. Breaking Bad, C. The Sopranos, D. South Park. Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Until next time, take care and stay safe.